Good evening. I'm Dr. Garima Arora. I'll be attending to you at this emergency today. Tell me how may I help you? And first of all, another thing I would want to know, how can I address you?
Good evening, doctor, but I'm really upset. Yes, my name is Sarah, and I hope you might be understanding the situation of my child who is hardly 4 years old. I'm literally confused what really happened to him. Is it a kind of viral infection, and what is the real problem? He started to vomit, continuously, and sometime it is a stained fluid, and he felt thirsty most of the time, and whatever he was drinking, he felt like throwing it out. So this was the situation. So I'm really afraid what is the real cause and reason, and how could I protect my child because he's hardly 4 years old. He's unable to eat or drink anything.
Sarah, I understand your concern. He's after all a little kid. Uh, what sounds, what happened exactly? It sounds like viral gastroenteritis to me. Do you have any idea what viral gastroenteritis is?
To be frank, doctor, I could say that I have no idea on this. This is the first time I'm experiencing with my child.
Well, viral gastroenteritis is the most common cause of abdominal complaints in a child. Usually, these age mostly due to viral infections. And it happens because of drinking contaminated water or contaminated food or not having adequate, hand hygiene. So probably viral infection which has irritated his stomach and intestine, which can lead to diarrhea and vomiting, and that's why he's not been able to take orally. And it may also lead to pain abdomen. So nothing to worry. Uh, he has been hydrated with the oral fluid. He seems adequately hydrated right now. So I think he should be okay in a couple of days. The disease is self-limiting.
Yeah, it's exactly right, doctor. Actually, he started to have this intestinal infection. As he told you, he started to got this abdominal cramps and nausea and vomiting, and probably sometimes he started to develop a kind of temperature too. I really don't know what is the way he has got infected because we use all RO water and how water or food which has got contaminated. I don't understand. Anyhow, how could I protect my child in the future, and what is the recovery period? How long would it take for him to get recovered? And as of now, in the current situation, as you know that I'm afraid, whether it could be signs and symptoms of COVID-19 coronavirus. So, what is your guess on this, doctor?
Well, I'm glad you asked all these questions. As I told you, it's a self-limiting disease. Usually the child feels better in a couple of days, usually 4 to 5 days. Yes, it presents with mild fever and, as I told you, abdominal pain, diarrhea. And usually the symptoms get better with days. The only thing we have to look after is that he's adequately hydrated. He's able to take things orally. Uh, so if that happens, he should not need any hospitalization. And yes, about coronavirus, I understand that you are concerned because of the whole spread. And yes, it does present as, it can initially present with abdominal symptoms. But as far as your child is concerned, I would not be thinking about COVID as of right now because he doesn't have any respiratory symptoms. So my suggestion to you is let's just wait and watch. Let's keep him adequately hydrated. Give him plenty of fluids, juices. Let's see that he is able to take things orally, and then we can discuss further. If you think he's not improving, you can always get him back. How
Right,
does that sound to you?
because I'm really thankful to you that you have ruled out that it is not the signs and symptoms my child has developed. That is not coronavirus. I'm really thankful to you that I'm really afraid about that. Yes, I definitely would follow the no what about the further precautionary measures to be strictly no incorporated to keep my child away from these kind of infections. But doctor, I'm afraid that if he got discharged, how easy is it for me to manage him at home? And because I think he is pale and weak and is yet to recover. So is it advisable to discharge and take care at home?
I understand your apprehension, Sarah, but yes, we've observed him for 2 hours. He feels and he seems better than the way he came. He's able to accept orally, and that is probably the best way. Yes, I would suggest that you keep looking for signs of severe dehydration. In case you think he's not able to accept orally, he continues to vomit, or he looks lethargic, or he has a weak and steady pulse, or you think he has shallow breaths, or his breaths are not good, or in case you feel and you feel for his pulse and or heartbeat is rapid, you can always bring him back. These are the warning signs of severe dehydration, so I would suggest that you look out for them. You continue to give him fluids, as I told you, a lot of coconut water, oral rehydration solution, juices, and light liquid diet or light soft diet. And he should be, as far as it looks to me, I think he should be all right in a couple of days. You can always come back to the emergency, as I suggested, if any of these symptoms or these signs of dehydration appear. Does
Well,
that sound
doctor,
okay?
I'm really thankful to you. I'm grateful to you. Thank you so much for your patience to answer all my questions. Definitely, I would follow all the do's and don'ts, and if there is an emergency, I would get back to you. Thank you.
Yes, you're welcome. Wishing your son a very speedy recovery.
Thank you, doctor.